Thank you, everyone. Okay. Is this on? Okay. Can everyone hear me? I have a pretty loud voice anyway. Thank you so much for coming. We're going to start now. I'm a stickler about starting on time. My name is Muriel Jones, and first and foremost, I am a parent of a son who's 32 years old, has a mental health diagnosis, schizophrenia, and he's also on the spectrum. I also have a 39-year-old daughter who has post-traumatic stress from her brother. So I come here with the lived experience. I serve as the executive director of Federation of Families of Central Florida. So as most of you know, we are one of these, I know a few people in here, an affiliate Federation, National Federation of Families for Children's Mental Health. So our mission statement aligns with that as well. I apologize. I'm trying to stay right in front of you. To provide support, education, and advocacy to parents and caregivers who are experiencing a child with an emotional, behavioral, and mental health need, as well as substance use, but across the lifespan. So we do not go away. We do not say when your child turns 18, you're good to go. We all know that it's the same book, but it's a different chapter. So it's just how you respond and support that child. Our vision statement, and the board just changed it about 30 days ago because we had a very deep conversation because I did not care for our vision statement. This aligns with the system of care core values. It's to ensure that every family in Central Florida will have access to quality, appropriate, and comprehensive mental health services that embrace the system of care core values. That was very important to me, that message comes across to the community. So we're here today to talk about respite. So I'm going to focus on a few points. Pointing at you, okay. Parents and caregivers, building relationships, implementation, where we are now, successes and concerns. Okay, so to talk about parents and caregivers, a little stickler that I have is that respite has been looked at as babysitting, and it is not babysitting. I can actually say that because I'm a recipient of respite. I come from New Jersey originally, and my son was, how can I say, violent towards me. So I needed a break. I didn't need a babysitter. I needed a break. I needed him out of the home so that I could at least have dinner in peace. So that's how I know so much about respite. So it's definitely not babysitting, and I'll tell you why. This looks like someone who's getting ready to go out, and she's saying, I need a babysitter. She looks pretty happy because she's getting ready to go out. She's going to have someone come in and care for her son or the daughter. Versus respite, does she look like I need a babysitter or that I need a break? She's pushing that help button. The person who needs a babysitter is not pushing that help button. No. So that's how I'm trying to explain that to our community agencies, because when they're referring families to us, they're saying, oh yeah, you can just drop your kid off and they'll watch your kid. It is not about the kid. It is about that parent so that he or she can take some time, do some self-care, whatever it is that makes them happy. So I'm really adamant about that. They probably in Central Florida want me to go back to New Jersey, but the thing is that it is not babysitting. And the reason why I can say that, I look at that picture and it's a stock photo. So you know it's someone that just sort of took a picture for that. So I decided, let me put in a real family member. I'm pointing at you. That's actually me in 2008. I was 51 years old. I was in a very dark place because I did not know what to do for my son. I was a prisoner in my own home. I was hopeless. I was sad. I had a broken spirit. And not only mentally and emotionally, I didn't even realize I was physically ill. I developed Graves' disease, didn't even know it. Why? Because I was not taking care of myself. I made sure he got to his doctor's appointments and my daughter, but I didn't. And I almost lost my life behind it because I had a high toxicity level in my thyroid, which was causing me to have chest pains. So when I went to the emergency room, because at that time I worked for a judge, I got up off the bench and went in the back, so he knew something was up. When they got to the hospital, they couldn't understand what was going on until they got an endocrinologist in there. And he said, "You should be dead. By now, you should have had a cardiac arrest. Your numbers were way over. 500 is a bad toxicity level. You're over 2,000. He said the lab stopped counting and said she's got to be dead by now. So that's why I am an advocate for self-care and for respite. And I make sure the parents know it is not for the child. It is for them. Because I have parents say, "Oh yeah, schedule me for respite. Let me check with my son or my daughter and make sure they want to come." And I said, "No, that's for you. That's for you to have a break. You just bring them here and we'll do the rest with them." Okay, what is important as far as Federation of Families starting the respite program was building relationships long ago when I first started working for Federation in 2012. Federation of Families has partnered with Orange County Mayor Demings, which is at the top. Together we can make a difference. That is not just the same. Orange County has been our cheerleader. They have really embraced the system of care, core values, and value what lived experience brings to the table. So in building those relationships, I made sure parents were at that meeting, staff, and that young man at the end, I flew him down from Jersey. That's my son. And I had him work with me over the summer that year we met with the mayor. And then from that moving forward, there isn't anything that goes on in Orange County concerning families and youth with mental health diagnosis or substance use without Federation and the families being at the table. They do not make a move. They make sure we're on committees. If the families can't get there, I make sure I deliver the message back to them. If they can be there, we make sure they are paid because their time is very valuable and they're bringing information to the county, to the stakeholders, to the funders, how important it is for them to understand the journey. It is not something, again, that when the kid turns 18, everything is fine. Oh, and please interrupt me. This is very informal. I like talking back and forth. So anything you want to add, anything you want to share, please just interrupt me. So in this picture in particular, and the reason why I wanted to stress about the importance of nurturing, not only building those relationships, nurturing and sustaining. This person is Chief Operating Officer of Embrace Families. We have partnered with child welfare, which is really unheard of because we're very small in Central Florida. But Mike Bryan saw the value way before the System of Care grant back in 2012, 2011, that there need to be a family support organization with parents and young adults with lived experience. And then, of course, that's myself, and the rest of the individuals are working for Orange County. There's the mayor. But this man at the end was a consultant at one of our committees. I sat on the Youth Mental Health Commission as one of the commissioners. He knew nothing about mental health. He worked for us for 2 years as a consultant. When he left his assignment, he could not believe how much he learned and how much he really appreciated families that are going. Had no idea, just kind of thought, oh yeah, a kid with ADHD, right? You know, they outgrow it. It's more than that. Okay, so how did we implement respite? It started in 2015, and it was very, very difficult. For one thing, the parents, even though they were saying they needed a break, they did not understand it was for them. They kept thinking it was for the kid. And that was the hard part, trying to engage them. But the more and more I shared my story, I have another PowerPoint that talks about the face of schizophrenia. I have another PowerPoint about a family's journey. My daughter did a webinar, 2 years ago during the pandemic that said, you know, as a sibling, I suffered too. So getting those families on board was very difficult. Once we got them on board, then I wanted to know, how do they want the respite? As you know, respite could be in home, out of the home, could be on a weekend or whatever. So they decided they wanted just in-home respite, 3-4 hours, maybe after school, something like that. So we did that. But then as we start to get more kids, we said we need off-site respite now. Because what was starting to happen was I didn't have enough staff to go into the homes. So I would end up doing the respite. Oh. Yeah. Yes. I started out with 4 staff, and then I hired independent contractors because I could not guarantee hours because it was all based on the needs of the family. So I started off with 4 staff. And then if you count myself 5. So I said, okay, we have a small office space. So what I'll do is I'll go out to the churches and see if they will let us use some of their space. We got some mega churches in Orlando. No, they were not interested because that was a liability. That was a liability. And I was like, okay. But there was a small church, Midtown Church of Christ, that I approached. Very small church. I think they had 50 members in the church. Opened up their doors. If you want to provide respite on Saturday, we'll make sure we'll have a deacon there and let you in. So that's what we did. So we worked with kids 8 through 10 at that time. So it was only offered at that time 215 through 219, up to 219 for just wraparound families, because that was the system of care grant and all that kind of stuff. So in 2019, again, we had to go through the recruiting and vetting of independent. That is ongoing, because when I discover that an individual does not have the compassion for these children, or that it seems overwhelming, I will give them the opportunity to leave, because it's really all about supporting that kid while they're in our care. I want the parents to feel comfortable that I have the right people at the table. Everyone goes through a level 2 background screening, but that I'm finding that is consistent. I'm consistently doing that. And then, of course, now there's off-site respite and community outings offered. So what we did, we went from the off-site respite to doing community, where the parents would drop the kids off at the movie theaters. We did a whole bunch of stuff. We did Universal, things of that nature, just to take the kids out of the home, because the parents no longer wanted respite in the home, because sometimes they just wanted to be home. So we just accommodate the parents. So here we are. This is where we are in 2022. So I just recently hired a quality assurance manager to really evaluate the respite program, make sure we're doing the right thing, anything that we need to change, start collecting some data. So that was mentioned earlier in the session that I was in, that it's important, and sometimes it's hard to pull that kind of data. Again, recruiting and vetting independent contractors. Next week, I will be interviewing for hiring a respite coordinator, because I'm still doing everything. And I'm tired. I'm like 65 years old. I'm like ready to retire, okay? And we're gonna hire a resource coordinator, because they can work hand in hand. The offsite respite is now held in our new, we moved 2 years ago into a new office space. So we have a youth room and we have cubicles where we can break it down. But we still offer the community outings to now wraparound families. And also Orange County has a breakthrough initiative, which I thought was great. They involve Federation, I involved our parents, I involved our young adults, and it's for children between the ages of 13 and 17 because data was showing they were repeatedly going back into the psychiatric. So if they had more than 2 psychiatric placements, then they were referred to this breakthrough pilot, which they were given a family support navigator to the parent and choices and options, not the hospital saying, this is where you go, take it or leave it. Now parents now have an option where the children want to go. So we fully vet also the community agencies that's part of this breakthrough. And of course, now anyone connected with Federation of Families is offered the respite. Our respite is free. And now we're getting more feedback from families because now they're understanding what respite is and the value of it. And right now we're in a position where I know that we need a standalone building. Right now we're in a multi-tenant building, but I would like to see respite overnight because I know that's going to make a difference, because when a child is in the crisis unit, they hold them from 72 hours, send them home to the parents, and they're really not ready to have them back because they're still trying to figure out, how do I support this child? So that is really one of my wish lists that I pray that it happens before I step down from the position. So our concerns, referral source, right now we're getting it from Breakthrough, from Wraparound, but definitely would like to open it up to other community agencies that are touching the same child really that's going through the system. Future funding from other sources. Right now, Orange County has been carrying Federation of Families since 2012. We have worked with other counties in Central Florida, but they did not understand what we were doing and wanted to change the culture of our organization. I was not having it. So I have, and I'm surprised my board didn't let me go, but they didn't. I said, we cannot compromise who we are and what we do. So it cannot be business as usual. We're more family driven and youth guided. They wanted to keep it provider driven. And I said, no. So we've walked away from money in Osceola and Seminole County, but Orange County truly has stepped up to the plate. So, and we want to strategically expand respite in the community. We want to invite other individuals to be part of this. Our successes is that we have a commitment of consistent funding from Orange County. We have been able to engage families. We are employing families. Some of the respite specialists that are helping us are actually parents who have graduated from Wraparound, young adults who have a mental health diagnosis but are in recovery but want to give back. So we have been able to stay true to our mission that anyone involved with Federation of Families must have some type of lived experience, because that's the only way that we can relate to the parents and then also to the children. Community partnerships, relationships. Again, I can't stress the importance of just really sustaining those relationships and offering this support again to the families at no cost. Another thing, since the gas prices have gone off the top, we also give parents a $50 gas card each time they drop off the kid for respite. So we want to make sure that the parents, we're not stressing them out by saying, you know, we can't come to you, we don't have a van to pick up the kids. We make sure that they're okay. Okay, just make sure. Okay, ready for the first video. Please excuse, this is one of our parents. I did not want to say to her, oh, this video is no good, but her message comes across. And that's the ALR.
Where are we going today? We are going to, where we at? At Respite. And what do we do when we at Respite? We play, that's right. And
You need me back? That's
Go
okay.
home in phase 2, and it's the most wonderful time of the year. That's the case. Right, baby? Yeah, Mama.
Okay.
Going today, we are going to, where we at? At Red.
Should I go back to the PowerPoint and then maybe? Yeah. Mhm. I'll tell you a little bit, something about this parent. This was one of the parents that could not grasp the idea of respite. And I knew she needed respite. I mean, she has not adopted, but she's taken care of now her nieces and nephews in addition to, okay, maybe this will come up now. So she was very excited to hear that I was going to share about respite. And she said, let me do a video for you. And I said, sure. And so when she sent it to me, and once I got here, I was like, oh, this video is not good. And I said, I'm going to show it anyway. You want me to come back? Yeah, go ahead. Real life, right?
Where are we going today? We are going to, where we?
Okay, yeah, you had the desktop. Oh, where's the rest of my stuff? Now I got that purple screen.
Where are we going today? We are going to, where we at?
We'll try to get it. No, that's
Then
okay.
we
We'll try to get it back. I'll come back there later. Okay. Uh-huh. You ready for me to just go forward?
Yes.
Okay, so I have two family members and I want to do a video. So they wanted to share this with the audience. There's a saying, it takes a village to raise a child. We relocated here a few years ago from New York and have no family in the area, but respite does help ease that struggle. It's a breath of fresh air. It is not easy dealing with a child with mental health issues, as time and patience is the #1 need. After a while, one goes into autopilot mode and forgets about oneself. But with respite, you are able to get that break, and she used that word break, with peace of mind, knowing your child is safe, socializing with other children and well taken care of. It has helped develop my child's social skills with other people, little by little, and trusting others and positivity. I appreciate each and everything you do for my child. Thank you. And that's parent CG. She was another one that I had to convince that she needed respite. And then we have parent AR. While the children were at respite, I was able to run errands, complete household chores, and even had a mommy and me Saturday with my youngest daughter, who is too young for respite care right now. She's starting respite on Saturday, this Saturday, her little one. Knowing that my children are in a safe and nurturing environment while being so well cared for takes a huge burden off my shoulders and allowed me to just breathe for a while. I simply cannot thank you enough. And it's interesting when she told me, oh, I was cleaning the house, I said, that's respite for you? But you know what? It was, yeah, she needed to clean her house. Sure. Yes. All the children, all the children. Yes. Oh, yes, absolutely. Absolutely. Yeah, oh, no, absolutely. We have kids on the spectrum. And I tell you, we have not, thanks be to God, and I just want to continue with this. We have not had one incident. Usually the parents come pick up and say, okay, you didn't call. Anything happened? I'm like, no. And I have just such an amazing staff that knows how to de-escalate. So we're really working on those social skills for these, for these kids, and they just kind of open up to us. And, I think it's the environment that we keep it very peaceful. Oh, the age. Well, I'm glad you asked that. We also we're doing 13 to 17, but then we found out they really needed a mentor as opposed to, so we connected the families with one of our community agencies, which the mentor picks the kid up, takes them out. So that's how that parent gets respite. So now there's a grant in Orange County for 0 to 8. So we're actually serving up to 12. So 0 to 12. So the youngest one we have so far is that one that she mentioned. She's 4 years old, but she's like a tall 4 years old. But no, that's why we want a standalone building, so we could provide that overnight. Right now, I feel like this is the bare minimum that we can do, but we make sure, like on Saturdays, we do 8 hours, 9 hours. We do Friday nights for movie night because the kids love Disney Plus, so they bring the kids over. During spring breaks or vacations, we have respite at the office during the week. So, yeah, sure. As often as they need it. They can, as often as they need it. We do not say, okay, you reached your cap. All right, come back next month. No. And there are times when I don't hear from the parents, like maybe I'll give them 2 weeks and then I'll call up and say, so how's it going? Oh, Muriel, I'm so stressed out. Oh, so you don't need respite? I do, but I didn't want to bother you, that type of thing. I keep telling them, you're driving the bus. Just, put it in my lap and I'll just make it happen. Yes. 10. Yep, I can, we can handle up to 10. As far as ratio, I have 2 staff to 1 child. Yeah, I do that as well. For liability issues as well. Because we have some very interesting kids, so we have to make sure I'm protecting the staff as well. Any other questions? Yes. Oh, okay. So the one thing about, and I'm going to go into, no, it's not clicking. Oh, before I go into this piece, which is very important that I wanted to share as well, is that the main objective is to ensure that parents are getting what they need. Because a lot of these parents are stressed out and the kids ends up being out of the home and they end up going into child welfare. And that's what we're finding out as well. It's just kind of rolling over. So we're trying to now intervene while the kids are young, between 0 and up in 8, 0 and 12. Because again, the teens that we were supporting the parents for respite, they really needed a mentor. And that was clear because they felt, meaning the kids felt, because they're on their phones, they don't want to do anything. And so it was very difficult to engage them. And then that's when I said, you know what, they need mentors. So, but I love respite. I just love it. Child welfare. Okay. We're talking about youth in foster care, implementation, where we are today, successes and concerns. This is another project that I took on that individuals was telling me, you don't want to deal with those kids in foster care. They have issues. This is why no one is adopting them, blah, blah, blah. But I was approached by the gentleman I mentioned, Mike Bryant. He called me up and he said, we have an issue. We have a problem. And the problem was that these kids between the ages of 13 and 17 were not in a permanent foster home. They were not in school. So what are you doing with the kids? Case managers are watching them. How are they working? They're not. So if they can't work to find a placement, then what's going on? And then the kids are acting out because they can feel the tension between them and the case manager. He or she wants to do the work, but I don't need you. So then they're eloping. So it was just, when it was explained to me, I said, that's a hot mess. Well, what do you think Federation can do? I said, just give me some time. Let me think about it. So again, you know, this is the picture of child welfare. These kids that we interact with have been human trafficked. And I tell you, there were times that I would go home and I would just cry because I said, I can't even imagine at that age having to deal with that. They've been abandoned by their parents, some of them by age 2. So they've been in the system since age 2, involved with drugs. You name it, these kids have gone through it. They don't have a childhood. They don't have like those teenage years. They're in survival mode. They're in survival mode. And it was really a shock to me. I mean, I knew, but to actually be in the room with them and listen to them, they're angry. They don't trust adults. They just want to run. And we noticed like around 3 o'clock, the anxiety level would go up. And I was trying to figure out why, you know, we had such a good time, you know, good day. You know, they get ready to run out the door, you know, we can't block them, you know, so we figured it out. The case managers were picking them up at 5 o'clock. And then that's when they would find out where they would be sleeping. And then lots of times it wasn't what they wanted. One kid, we're taking you to Miami. What? From Orlando? So that's what we had to deal with. And it was hard. Let me tell you, it was not easy. And I second guessed myself, like, why are you doing this? So we laid out some goals and objectives with child welfare. So we wanted to provide a safe and nurturing environment for the youth in foster care, waiting placement, or refusing to attend school. And I totally understand why they didn't want to go to school. I mean, you got everything you own in a garbage bag, because that's how they were coming to us. So between the hours of 9 to 5, Monday to Friday, that's all they wanted. You know, the child welfare agency said, if you could just do this for 3 months, we'll figure out something. So the outcome is to provide, of course, a supportive program for youth and to replace, during the day, to replace the current arrangement, which was sitting with their case manager. The second outcome was to engage youth with positive role models. So I was very intentional who were around those kids. Outcome 3, to focus on the youth's strengths, social skills, and build a positive, nurturing environment that include activities that were identified by the youth. And that's what made the difference. They had someone actually listening to them. And the population served 12 to 17. Now we're getting 10-year-olds coming in who are acting like they're 17. Whew. So we started this in September of 2021, and we were supposed to do it for 3 months. It lasted 6 weeks because we had them in our office space, which is a multi-tenant building. And when they start cursing and hitting the wall and throwing things, I was like, okay, they're going to kick us out of the building. So I had to shut it down in 6 weeks. I explained to them, to child welfare, this is not a good location. And also, I think they were uncomfortable because the area we're in is very upscale. And I think that was intimidating to those kids. So I said, no, we need something else. I don't know what to do. We're not in a position to, you know, rent out a building right now. Orange County is paying our rent. I don't want to upset them. So what happened was that the staff, then I realized some of the staff that I had were triggering the youth. So there was another thing, triggering the youth. And then we decided, all right, we need to have more trainings. After the 6 weeks, I was just done. So we had to reset, refocus and restart. And that was only because child welfare kept saying, I know you could do it. You did it for 6 weeks. We now have to support you better. They were paying us. Oh yeah, they were just, whatever I asked for, they paid. It was no negotiation, no, you know, X amount of money per child. No, this is how much it takes to run this program. So they came back in December of 2021 and said, okay, we have a building that we house the case managers and different agencies. There's one side of the building they've been using as storage. Come over and see if that you can utilize that. Sure. Once I went over there, I took a staff, young person that had more vision than I had. And I said, you got this out, we can work with this. And then that's what we did. So we started back in December of 2021. It was only supposed to be for a couple of months. We're still doing it. So we're still providing that support to those precious kids. I'll do it again. There you go. So I went from, for this youth support program, it's youth support program. And of course, child welfare said, drop-in center. I said, I hate the word drop-in because you're always dropping the kids off. Yes. Mm-hmm.
How many kids were in this?
We would average on a daily basis between 4 and 8 youth. That they,
Many of them on a consistent basis.
yes, on a consistent basis. One in particular stands out. He was like, he had this wall up. And I had one of the staff, I said, you just need to find out what he likes. Turns out he wanted to be a marine biologist.
Oh.
And he loves Legos. This kid is so good with his hands. So I went out and bought all these different types of Legos and stuff on marine biology. And he's wonderful, wonderful. He's turning 18 soon. I started off with 15 people at this program. You see how I scaled it down? I've scaled it down because these individuals get it. So right now I'm going through the process again of vetting more people, but they have done a phenomenal job with the youth. The one in the middle, Mr. D up there, he is an actual employee of Federation of Families. He's supervising the team over here. The 2 women, they're parents. They're parents of Breakthrough, they're parents of Federation of Families. And then we have the young adults back there. And they just know how to interact with these kids, and it's just wonderful. They are paid. I paid the youth support specialist $18 an hour. And my supervisor makes $20 an hour. So he makes like $41,000 a year. My thing is to, you know, because everyone was saying, no, just pay him $12, $13. I said, no, you haven't been around these kids. You get what you pay for. And they're very committed. They're very committed to the program. I can't guarantee them 40 hours a week. It all depends. But let me tell you how committed they are. During Hurricane Ian, they Embrace Families, the child welfare, said, okay, we have to have the kids. We found group homes. The kids are going to be the group homes, but they don't have enough staff. All of them stayed with those kids at different group homes 3 nights. They didn't go home. And what did Embrace do? They said, we're going to pay them $32 an hour for doing that. And I'm telling you, they're just amazing. If I could just clone them. But yeah, so that's what I'm saying about a relationship. Yes. Mm-hmm. Because child welfare thought they could figure things out in 3 months. Give us 3 months. I said, okay. So, yeah, right. So our concerns are always the youth, because we know this is not a problem, just a Orlando, Orange County problem. It is nationwide. That case managers are overworked, underpaid. Kids are just being, and seriously, re-traumatized. They're just continuously to be re-traumatized. So it's like, what can we do So we have been successful in engaging youth. We had a few youth who they were going to school, found out about the program and acted up so they could come to the program. And I was like, oh man, they're gonna take it, we have complete autonomy to structure the program how we see fit, which it's youth guided. We had one youth in particular, he liked to punch the wall, 16 years old. So I went there and I said, what can I do for you? You're punching the holes in the wall and, he said, well, if you can give me a punching bag, I'll punch it. I said, I can't hang a punching bag from the ceiling. I'm thinking, he said, no, lady. He said, they're standing punching bags. So I said, well, show me on Amazon and I'll buy it. He took my phone. He pulled it up. He said, here you go. So I wanted it. So now he's punching that bag, like ripping it apart. What we're doing now, we're doing Monday, Wednesday, and Friday, 9 to 5, but we have expanded hours on Tuesday and Thursday, 9 to 9. That's how committed that staff is. We have our budget contains also purchasing and buying food. And I don't mean ramen noodles or mac and cheese that we buy them food from restaurants that they have not eaten, never had. And we have, yes, we spoil them. Yes, we spoil, they deserve it. And we're, and the other success, we're employing families and young adults. And again, just keep nurturing those community relationships and partnerships. So in closing, we're good. Yes, okay, yes. Mm-hmm.
Have you found yourself having to teach them table manners, proper etiquette?
Good question. Yes.
Function.
One of the requirements of being in the program is that during lunch and on the late nights when they have dinner, they eat as a family. First, there was resistance, and we said, well, that's part of, rules, that now they get it. And also no cell phone during the time they eat. So they agree that, but they want to see the cell phone sitting there. They don't want us to take it and put it away. So we compromised on that with them. So yes. Mm-hmm.
I have found that probably the third one, my granddaughter's special needs. And they don't associate with people that are going to Harvard. So the kids, they bring home, they're not in child welfare. They are, the old term used to be latching.
Yeah. Mm-hmm.
All probably grants. And what I found was it's all fast food for them.
Yes.
And I made them very much to sit at the table and just, very carefully and things like that.
Yes.
You do this because they had no,
Yeah.
I thought, oh my gosh, well, Walt was stepping for something for them.
Absolutely.
They don't want to go certain places because they don't know what they don't know.
I had one individual, she was a family member, but just being around the kids would trigger her because just so much they have gone through, a lot of human trafficking and stuff like that. And it was affecting her mental health and her physically because she would go home and cry. But she used to, on Tuesdays and Thursdays, she used to cook meatballs. So they say, oh, we want spaghetti and meatballs. So she would make spaghetti and meatballs. But pasta seemed to be the real thing that these kids like. And sir, you had a question?
Yeah. One of the stuff, and I realized when you first started with well-being in the system, they didn't have transition. So like out here, like you used to have like a man like that system was in place, like what about college or what about like
Yes. What my staff, they encourage them because Embrace Families, Child Welfare, they have those programs in place, but the kids are a little resistant to it. So those young men that you saw in there, they talk to them like, you need to have a plan when you come out. What would you like to do? If you don't want to go to college, what trade would you like? that, all that is accessible to the kids. But I don't know, is it a trust issue? Like, yeah, this is too good to be true type of thing, but it's available to them. And there have been successes where, because they also embrace families, help them get their license, get their first car. You know, they have to, of course, meet certain milestones in order for them to, you know, get these rewards. But it's there for them. It's just a matter of telling them it's okay. You know,
What I realized that a lot of them aren't prepared of like the benefits that come with being a child welfare. I wasn't aware of how I anticipated that they would pay part of my school.
that's right. You're right.
I didn't know about
Mhm.
it. All the youth that I work with, like, yo, they're for the state. I don't understand that term, but they have to pay for you to go to school.
That's
Like,
right.
a lot of you that-
You're right.
Most of you, I tell that they're not going to wear that, like, that knowledge, you know, to.
Are you in Florida? I'll hire you.
Oh,
Are you in Florida? I want to hire you.
no, no,
You're I was born and raised in Newark, but then I graduated high school from East Orange.
Yeah, I'll say, I'm from New York, and I went to college, in Kentucky. We actually just flown from Kentucky today.
Oh, okay.
Yeah.
Well, I congratulate you and applaud you because you are hope for these children. You really are. That's why I said you live in Florida. I in a heartbeat. Yeah. Anyone else before I show this video? Yes. Oh, did I hit you?
Do you partner with any of the, in Pennsylvania, we have tech schools, like kids instead of going to high school, they go to tech school, welding.
Mhm.
There's all different things.
Orange County Public School is one of our partners as well. So it's Orange County Public School. When I say it's a community effort, law enforcement is involved. You name it, we're all on the same team because we're all touching the same kid. So it just made sense for us to all work together.
On a lot of schools, no, it's not the old days when there used to be a first teacher, but I was,
Mhm.
no, there's just huge options out there, what you do, you know, that.
You know, look, yeah, kids that are on the videos all the time, well, why don't you create a video? You know, why don't you do that, you know? So you're right, there's a lot of options. Did you have something?
I was thinking, I actually worked for child welfare in the state of New York for the years, and living in Baltimore County, so Jacksonville.
Okay,
And so we stayed for the paying for college, and when this, it has to be a state university or it is tech. Depending on where you are, it's not a permanent, foster care home or, people can run to the situation, they still qualify for the benefits. The foster care program and after the years of it's 18 to 21.
right.
Did that. And the really interesting that I work with, there's a high turnover there.
Mhm.
I think I survived
It is.
12 years before I moved.
That was good.
But that time was supervisors and the staff turnover, it's very staff that stayed long enough to connect to those older youth to tell them about the benefits of if you do this and you get this and this and this, and even when we had some that at 18, I won't have anything to do with you, I mean, this system, and then they could come back a year later, it's a year out, we weren't almost trying to figure out, they're like, oh, this is up.
Yeah.
And us, and trying to say, hey, now we all be like, God, it's a better, situation.
Sure.
So I'm in trouble with that. And a lot of kids I work with are either like services custody, like, or with ACFS. And I find oftentimes, yes, they don't know about the options that are available to them, but they're also extremely intimidated and they don't know how to access those services. So it's like, here's all this information for you, do it, and they're saying they have
They don't have the life skills.
Exactly.
And so, I, for instance, I'm that, like, okay, let's go together.
Mhm.
Let's make, let's like, apply for services or, you know, and teach them like how to access those things instead of just tell them. Because I find.
Oh, I agree with you wholeheartedly.
Like, I mean, my daughter's actually in foster care and we've had 5 caseworkers in 4 months. It's like. Caseworkers that have said, it's not important for me to connect to your child because I won't be involved in their life.
Oh, my
You know,
goodness.
like just really pure, like, it's very, so I'm saying like. We can tell them all we want, but really need to. Teach.
You need to show them, yeah, right, exactly, exactly. This last video I'm showing is Mike Bryan, the COO of Embrace Families Child Welfare Agency, managing entity in Florida. And it was very important for especially organizations and to hear what he has to say because usually it's very unlikely. People were shocked that they partnered with such a small organization, let alone a family-run organization led by Muriel with the big mouth. All right, that rats out anybody if you're not doing the right thing. So could you please play that?
Hi, I'm Mike Bright. I'm the Chief Operating Officer of Embrace Families.
Can you hear
Embrace
me?
Families is a not-for-profit organization in the Central Florida area that serves as the lead agency for foster care and related services. It's been my pleasure to work with the Federation of Families of Central Florida. And in fact, one of the things I'm most proud of is being one of the founding members of that chapter. Every day I see and hear the impact that Muriel and her team have had on our community. And I'm just astounded and just so pleased to have been a part of it. And so one of the things, and I think this is the most important thing I've seen with the Federation of Families, is the ability to connect community, the ability to be able to provide stability and hope for the youth and families that we serve. And so we have had over the last couple of years within the foster care system, what you've seen throughout the nation, where youth have been coming into care with a very complex needs, high levels of trauma. And in the foster care space, that really equals placement and stability. And we know that when you're dealing with those issues, instability is not a good way to go. It makes it more difficult, especially as we're developing. So I reached out to Muriel and said, Muriel, we have some kids that really need some help and they really need some connections and they need exactly what you guys have been doing for our community as a whole. And as always, Muriel just jumped right in. And not only did she jump right in, she looked at the issue. She created what we call our drop-in center. It's a great social environment. It's a great safe space, but most importantly, it's a place for our youth to have a level of connection with caring adults and other youth that have walked a mile in their shoes while we're awaiting placement. And that does a number of great things. Number one, it gives that youth that value. It allows them to value themselves. It puts them in a space in which there are opportunities. When those opportunities present for a great placement, it makes them more amenable to doing it. It also helps our case managers. Our case managers aren't having to worry about where are the kids, what are they doing? Are they going to school? Are they not? We have someone that's there that we know those youth are in good hands. And not only in good hands safety wise, but those people that are going to help brighten that youth stay. And once again, our overall end in this partnership is to help those youth get stable. So when those great opportunities present for placement, they will take those. But when those great opportunities present for school, they will take those. And so it was in retrospect, a very common sense approach, but that common sense approach of being able to develop that relationship and that partnership between us and the Federation really came from a number of years of just developing trust between our organizations and developing trust between our staff and our leadership as people. So what I would like for, and what I think might be a great opportunity for you guys to do is get to know your foster care system folks. When you're in a meeting, you're out in the community, have those conversations with them, see where you guys have that mission alignment. And I bet you dollars to donuts, you're gonna find that, there is a lot of mission alignment between the work done in the foster care system and the work that's done in the community through the Federation of Families. So, thank you, Muriel, for this opportunity, and I hope you guys have a great conference. Take care.
So that's Mike Bryan, with child welfare. And again, I just want to thank you, and I thank you for your participation, because I felt like I was in someone's living room when we were just talking and kind of spilling the tea, so to speak. So I truly appreciate everything, and I hope oh, let me give you my contact information. Can I flip it? Oh, see that? Yeah, that worked. I'm not sure about my LinkedIn because I'm not that sure about it, but you'll find me if you need me. But I would love to talk to any of you, any guidance, any suggestions. I'm all about sharing information. And I would love to see all agencies, especially agencies serving families and youth, to get more involved, especially in the respite piece, because that is one service delivery gap that these parents need. So again, I want to thank you all for coming.